Hello my dear girls, today's lesson is for the lower part of our face. At some point we will need the gloves, so have them ready, and we will start with this exercise to wake up everything and then stretch our neck. Remember, you consistently bringing your elbows higher, and remember that without working on your neck, you might not even bother with changing the jawline, jaws, because the neck is superior. And that's not the amount of exercises you do on the face, it's the amount of effort and commitment you have in order to fix the neck. So please, 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 neck, and massager is the most important in our business. Consistently bring your hands closer to the ceiling. Take inhale, make them higher. Exhale, drop them. Exhale, inhale, exhale, inhale, exhale. Open your hands up. Place one hand on your clavicle, melt in and stretch what you just compressed. Try not to help with your head. Try to have your head straight. Sometimes I move the head so you know where my hands are going, but ideal world, the stretch is happening just like this. And slow, slow, prolong up to the jawline. Melt in and move that up. Very good. Now we will give a little bit attention to our clavicle bones because this is all platysma. And we will start with the beginning of the clavicle. Use another hand to kind of help this finger go deeper. Right under the clavicle, I want you to start doing circles. We will go up to here, so very little process. Make your shoulder go a little forward so you can get in deeper. And when you get in deeper, use your other hand to kind of push the elbow without pushing your finger and start massaging it in circles. And you can include the movement of the shoulder. I know it's a lot, but this is subclavius muscle, super important for our shoulder rhythm, not only stabilization of this joint, but also the depression of our clavicle, and it's also guardian to the carotid process, so our scapulus. And sometimes a lot of people miss this spot and never can fix their shoulders. So it's 1-2 spots. Then I go a little deeper, and it's, if you find that muscle, first of all, congratulations, because it's pretty deep, and secondly, it won't be pleasant. Now take 2 fingers and with this hand pre-tensing in the tissue, but not like somewhere here, right? Right under, and you will go with vibration just on clavicle. You will slide this towards your shoulder. Couple times. Slide this towards the shoulder. Slide this towards the shoulder. The same here. Move your shoulder to feel that divot where your clavicle bone starts. Start moving. Have this help to understand how deep you can actually go there. And you can actually go very deep. And start moving, rotating your shoulders in a different direction. And go move a little bit. And see if, if you press and that's enough, you don't need to do the circles. If you feel like, okay, this is already from 1 to 10, pain 6, you don't have to do the circles. But once you feel like, okay, your tolerance that feels better, you can start moving your finger. Very good. Now pre-tense and a little clavicle. A little bit deep with a little vibration. Just on the clavicle bone. Love to the clavicle bones. Now we will place one hand here, yes, And with this hand, we will slide right under our chin. Oh, chin. Jaw. This is not chin. Jaw. Right under. So this is the line of the bone and right under. And we will drop our head on it. And pre-tense the tissue. Don't like push your head. Yes, just pre-tense. Just a little bit of intention to go deeper. Drop this head, drop this shoulder, pre-tense this tissue. Have your tongue on the upper palate. Drop, drop, drop. We need to relax and stretch this platysma if you want any changes to our lower part of the face. A little bit more, girls. You will see how your hand gets sink in, yeah, deeper and deeper with time. And if you use the pressure of your head, like tilting, it will help the hand go deeper and relax. Good. Now another one. So slide, slide, slide. Find that bone and lower it. Drop your head. And see which side feels less tense. I know it's hard, but try to really be there with your hand. Try to have your eyes on your hand. Like for me, it's obvious that my left is shortened. Again, because this shoulder is higher, but that's not my shoulder fault. It's my rib cage fault. And we all have some rotation at some point, especially people who wears handbag on one side or just their occupation. I don't know, if you're violinist and you play violin on one shoulder, of course you're gonna have that discrepancy. Relax. We will do some of the neurovascular release. What we're going to do, we're going to place our fingers here, a little poke, and right here in the middle of sternocleidomastoid, right in, what is this coming from? Right in behind, we will do a little swap, tilt the whole body there. Inhale, this is poking right here, and this is swiping up. Inhale, inhale, inhale. Inhale deeper, deeper, girls, deeper. And exhale fully. Keep swapping, keep poking, and bring your head straight. And relax. Check how it worked. Yeah, this side for me seems to need some work again. This poke, sternocleidomastoid right behind, swap, tilt the whole body. Inhale deep. Inhale and exhale fully. Bring your head straight, the whole body straight. Now, next should release some of the things. Now the platysma. This is a platysma technique. Don't think this is when we roll the pectoralis. This is a platysma. This is when you take this much as like little skin basically, and this fold, you folding it in. You see the skin, not usually I ask you deep, 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 deep till you feel the bone. This is different. This is just the platysma, and we go straight to our neck, beginning. And we take one below the clavicle, on top of the clavicle, here, here. So this is just a platysma technique, and the girls who doesn't like how their neck looks, particularly looks not perhaps shaped, right? Just increasing that blood flow to the platysma will really change. But again, the lower levels of the neck has to be relaxed, stretched. This is just a platysma technique. Girls who has here a lot, I have a questions towards your chest and towards the back of the neck, because if the back of the neck is shortened, where the tissue will go? Guess where? Here. And it's not only your skin. And girls who has like very thin skin, they're like very thin skin, they're like the skin almost has no nutrients and got unstuck from the muscle. It's usually a little bit happens with time. You can fix it, but please have some patience, literally. Have some patience, because skin needs first the blood flow. And the blood flow will come when the muscles here under the chin, you can take a little deeper, because no harm in this, but still bring it here. And now again from this side, rolling, 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 rolling. Girls who is still upset with how they're under this area looks, masseter, 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 masseter. I see a lot of good before and after, and it makes me very happy, but sometimes I see that that masseter still needs a little work. And if there is anything that we kind of will be doing for the rest of our life, it's a masseter release. Unless you live stressless life, never clench your teeth, never upset about anything, I'm happy for you. Then you might need masseter release a little less less than people who reacts. And our reaction as a society, all of us clench our teeth as first. Deeper, deeper, deeper. Now light swab on the front of our neck. So just light, feather, 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 a little deeper, get this all tissue, another hand, and start shredding with a little neck movement. Shred all the way, and at some point the fold will get shredded. Very good. Another one. And the third one. Very good. Now we will go into the masseter. Of course, there's nothing will be changed here if the masseter is still clenched. What we're going to do, we're going to take one finger next to the zygomatic arch. Yeah, we'll be holding, waiting. Girls, not here, not here, not here, right here, next to the nose, okay? And this, so this finger will go, the thumb will go very deep, taking every fold here. See how deep? And then you open the mouth. And the fold disappears. If your fold is not disappears, you didn't go deep. Try again. Try again, or do the simple relaxation with the deep circles. Because this is already removing the tension from the deeper layers. Again, very deep, very slow. I tilt my head. I take this huge fold. I understand this is, so the difference between this fold and this, you see? Like this, next to the ear. Open. Of course, this finger will kind of help you to hold it. Third one. Deep, deep, deep. You feel the bone. I feel the bone. I feel the bone. Open till it's comfortable for you. No clicks, please. Now we take our finger in this position. Tilt the whole head. Dig in. Pre-tense. Without doing anything like this, just Like here's the glue, glue. Tilt. And slowly rolling it in, go on the corner of your face, not here. Slowly. If you go faster than me, you're doing it wrong. Now we will go, so we were doing like this. Now we will tilt our finger a little bit like this. So before was straight, now it's a little bit like this. We're just going to take different fibers. But still close to the ear, not in the cheek. This is the cheek. Just a little tilting, like this versus like this. Basically you went like this, now you go kind of like diagonal. But still on the bone. Stretch. Stretch. Compare. This side should feel different from the ones that you didn't work on. Straight next to the nose. Why did I say nose? Next to the ear. Good. Girls, the lesson will be longer. But I heard a lot of you don't mind, so thank you. Good. Now a little bit on the angle, so find your bone, understand where you're not gonna go. And just stretch. Stretch. Now make the face when you don't like something. You see this beautiful? So what we will relax it. Place 2 fingers and massage it away from the chin. So deep, like you're massaging the gum of your teeth. Right here on the corner. Circles with intention away from the face. Good. Just little lengthening, superficial, just to calm the skin. Now the chin. Girls, please, the ones that have some bruising after like first time we did it, just be gentle. It can be just the blood vessels are there. And use your lip, bring in your lip like this. Just the chin. Slow. Tear up your head. Deep. Very good. Now we will take our hand and we will find our masseter again. And this is the area of the jowls, of the wrinkles here. Hello, buccinator, risorius, lip, and masseter. We will take this hand and bring this tissue towards here, deep, for 20 seconds. Yes, it will create some stuff here, but we need to do the post-isometric here. You bring in it here, you wait. Deep. Now relax and slowly just calm the tissue down here. Deeply, you glute and you do a little stretch right here. Okay, now here, and then we will take the gloves. Find the bone, bring this hand, the tissue, everything deep, and hold. After this lesson, you should see an improvement in that area. I'm not promising that it's all, that's it. Go back to your 14, 13, but the improvement. And the improvement, you need to celebrate the improvement, girls. Not like, oh, it's still there. No, it's moving. It's moving in the correct direction. Stretch. Good. Take the glove. We're going in. So what we're going to do with this Rizuris, you're gonna go on your cheek. So this is a muscle right here, and there is another muscle, buccinator, there. You're gonna go into your cheek. Get deep into your cheek. Pre-tense the tissue, yeah? And you're gonna go this way, okay? Deeply, but not super, in a comfort zone. And you're gonna blow your cheek like this. So you go, you find this tissue, you're like, okay, I'm in, I'm not just in a slide in there. And then you go slowly with your big finger is dragging the muscle there. From your mouth to the corner, and you're gonna start blowing the cheek. To the corner of your mouth. And try now without blowing your cheek. You feel that a little more tense versus when you blow it? Try with and without the blowing, because you will feel it's like a slip of the muscle. It's one particular line. The idea is we using the muscle, so it's imagine if I would do massage of the bicep while working on the bicep, while contracting my bicep. So, while stretching it, like this. One more. Very good. Now, from the bottom, so this is area that we work, we will be doing circles, lift, but not deep when we pull this tissue out like this, No, more like nicely massaging this in a circle, pre-tense the tissue, and lift. Then go a little bit further, so my fingers here, do the circles, and a little lift. Then a little higher, circles, and lift. Circles, and lift. Circles, and lift. Just one nice lift. Now we're gonna go under right, where's our depressor, right here on the corner, on the corner of the mouth, right this slip. And here we're gonna pinch and lift, then pinch here, then pinch here. Pinch, 10 seconds, and lift, then pinch another area. That was not 10 seconds because I'm afraid it's too much time. Pinch, let me hold it for 10 seconds. And lift. And then I'm pinching the corner of my mouth. And then massage in circles. Relax your lips. And relax. This area might be red, might be a little bit of puffy right now, but just in general, if you do it correctly, it has to improve the look of all of the tissue, ligament. There is a ligament there that creates that wrinkle, and then when it's a lot of lymphatic, that's what creates that pocket. That pocket, that we don't like, as we call jowls. So one thing pulling it down, another thing as masseter doesn't let the liquid flow correctly, and another thing the ligament, the depressor, a lot of things going on. Find that cheek tissue, nicely, not super pressed in. Start blowing your cheek and slide towards your mouth. Oh, interesting. Very good. One more. Now from the bottom, circle. So this corner area, circle, light lift up, light. Lift. And once you do it light, you can try to put a little more pressure. And if you feel like, oh, there is a tension, then when, you press, and if there is a tension, it needs the bigger amount of pressure. You feel it. So if the tissue gives you back, pull you back strongly, you need to apply a little bit more pressure, but still work with the tissue, not on the tissue. Like I feel here on the slip of the muscle, it's definitely different density of the tissue. And I will, do more inviting circles. And then a little lift. Then depressor, pinch. 10 seconds right here. And big finger lift down. Then another side, pinch, another step, and lift, and the corner of the mouth, and circles on the corner, alveolus. Relax your lips, do like this, and you just walk on the lips. And the cheek lift. So one finger is waiting, another finger is slowly, superficially start vibrating the tissue. Don't do it like this. Wait, give your tissue time. Little, not this. Lips opposite direction. Not pushing, waiting. And this finger, when they're gonna get close, this finger also gonna start moving. moving both fingers and just making sense to go to the temporalis lift, to the temporalis area like this. Again, slow. This is not the finger working on a tissue. This is when we take and the tissue inside of the tissue massaging. So it's not this. Yeah, it's more like tin 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 from the inside the tissue, that cheek fat muscles. Wait. You need to wait here, not force it. And go like this. Second one. Both fingers moving and lift. Not just nicely. Wait, and lift. Very good, girls. See you tomorrow.